Chicago police fatally shoot a man suffering from that. The Chicago woman now expressing regret for calling police after they began wildly shooting, killing a black man suffering a mental health crisis in a hail of bullets at a senior home. The anguish on her face. 57-year-old black man reportedly shot multiple times by Chicago police officers who responded last week to a 911 call from his girlfriend, who said he was holding a knife and acting strangely. And a Black Star with the information. Charlotta Pritchett said at a press conference on Monday that her boyfriend, Timothy Glaze, was having a mental health issue and that police used excessive force when they arrived at her 6th floor apartment at the Albany Terrace Apartments, a public housing building for seniors in the Little Village neighborhood of Southwest Chicago around 2 a.m. January 3rd. Pritchett said Glaze, whom she had known for 6 years, was exhibiting an odd demeanor that evening, had a glazed look in his eye, and had been walking around for about an hour holding a paring knife, so she called 911. He sat next to me on the bed with his knife. Like I said, he was treating it like it was a pencil or pen. And I think he said, "I'm not going to hurt you. I just want to talk to you." And I just felt uneasy, Pritchett said. I knew he needed some help I couldn't provide. When police showed up, Pritchett, who had taken refuge in a neighbor's apartment, said she heard police radios and 2 or 3 voices command Glaze to stop, don't move. Then they began wildly shooting, she said. When police arrived and knocked on the door, Glaze confronted and advanced at them with the knife. That is according to a police statement. We'll see if it's true, see if there's body cams activated. Officers then shot him multiple times. They immediately rendered medical aid, but Glaze, who had been shot in the chest, was pronounced dead at the hospital. Now, Pritchett and several community activists who spoke at the conference said Glaze was a small, medically frail man who did not pose a threat to officers. And they questioned why police did not use de-escalation tactics before resorting to lethal force. And she explained what was going on. Why rat-a-tat-tat on the door? Why not use some kind of negotiation tactics? I don't know. Just a thought. Glaze weighed 125 pounds, was recovering from cancer, moved slowly, according to Pritchett. You come into a senior building with that much firepower when you could tase, you could mace, but him being so small and you all being so big, a couple of you could have just rushed him, grabbed him, she said. Or perhaps some other kind of a neutralizing thing. She's now at the other apartment, right? When the police show up. You don't know if there's somebody else in there. She said there wasn't when she left, but you don't know what's going on behind that closed door, except that you've been told someone's having a mental health crisis. I'm not a mental health specialist, but we shouldn't have to be to see what's plainly square in front of us and take a common sense approach to just this thing called life. When you value life, I don't get how we can't advance beyond this narrative that shoot mid-mass, shoot to kill, fire as many rounds as you need to take out someone, whether they're frail, 125-pound, recovering cancer, senior citizen, or the next person. It's barbaric. It's not civilized yet.
It is uncivilized. It's like we've forgotten how to live with one another. We've forgotten what it means to be a human being and what it means to value that humanity within us. And the cops, they're meant to uphold public safety. They're the ones that we are all supposed to call whenever things aren't right. If the situation is out of their scope, they're supposed to get the people that we need to help us, right? Whether that's an ambulance or a firefighter or a referral to someone else, a mental health expert, if that's the case, whatever. But they're supposed to help manage these stressful and or dangerous situations that people might find themselves in. But instead, they so often turn up and just make things so much worse than they already are, or so much worse than they ever needed to be, oftentimes involving deadly weapons and deadly force when like there's just no call for it. There's a reason why people are hesitant to call the cops these days. And you're right, we shouldn't all have to be mental health experts just to exist with one another. Cops shouldn't have to be either. They are not mental health experts. And I get that their jobs already have a ton of uncertainty. And oftentimes that uncertainty can be related to a very dangerous situation in which their own lives are in danger. But I don't know what kind of training they're getting, but the focus should be on de-escalating. Why are they escalating these situations that are already not dangerous? Right. In this case, they were told what was on the other side of that door. They were told that there was a mental health crisis going on. They should have gotten somebody who could help with that. I don't know why guns were even taken out in the first place. I
Yeah.
really don't. There are other ways to, if he was like flailing or doing something, there are ways to put somebody down without shooting them and killing them. And the cops, I get that their jobs are stressful. I get that they need to react very often, very quickly to things. And I understand that they need to make very quick decisions. But whatever the reason, the end result is that people who should not be dead are now dead because the cops have killed them.
You knew the situation, and I need to know more. Did you, is there a mental health task force? I mean, this is Chicago. Did
Yeah.
you engage with them immediately and try to figure out more? Or did you just come, it sounds like, and go rat-a-tat-tat? She heard them. It's not like they went and talked to her. And I would go talk to her in person first. Okay? Say, okay, what more can you tell us about this gentleman? Didn't do that, according to the reporting.